Today I'm going to talk about the OCT. So OCT, I think lots of you already know the OCT, how OCT works, and what kind of applications for OCT in the medical field. And so first of all, I want to thank my collaborators and both local collaborators and external collaborators. And also, I want to thank my team members because I'm not doing the work. All the results I'm going to present today is really given by my lab members. So that's you see my mouse, right? Okay. And so this is my lab members I want to thank, and also, of course, the grant support from agencies. And so that's an acknowledgement. And OCT, because I'm going to focus on OCT, how OCT works. So some of you may ask, what's the OCT? OCT is actually very ancient technology. And I think the first inventor for the OCT is actually Microcirculations. Okay, so we know the Microcirculations, we know the Microcirculations interferometer, right? I remember that in my high school physics, my physics teacher already taught me about how Microcirculations interferometer works, and so that's a really ancient technology. It's about 150 years old technology, and so this is the Microcirculations here, and so actually Microcirculations is really had a huge contribution to our field, in particular the optics field, and he invented this his Microcirculations interferometer to measure the distance and speed of the light, and actually this contribution from the Microcirculations honored him a Nobel Prize. So by the way, Microcirculations is the first American who get the Nobel Prize. Okay. And also the second, third, and the fourth Nobel Prize winners in America is really his students. Okay, and all the Nobel Prize for his students is really based on his technology. And if you want to look at the list of the Nobel Prize over last 150 years, so you can count them. And in fact, it's the Nobel Prize about 15, more than 15 Nobel Prize winners is really based on his technology. And this is actually Microcirculations interferometer. And so, however, over the last 150 years, the Microcirculations interferometer only used for industrial applications. As I mentioned, it's really a majority of the use is to measure the distance, right? Or surface roughness, or to measure the speed of light to find the stars in the universe, right? And nobody think of that using the Microcirculations interferometer can look at human tissue. And this is a kind of turning point to look at the human tissue using Microcirculations interferometer. And this is about 30 years ago, right? 30 years ago, so three scientists in MRT, which is who are the James Fujimoto and David Huang and Eric Swanson. And they look at the Microcirculations interferometer, and thought that, Microcirculations interferometer will be very useful to look at human tissue. And because we know that about 30 years ago, we know that the light, if you're shining the light onto the human tissue, the light will penetrate, right, into the human tissue. And the penetration of the light, if you can measure that penetration of the light in the human tissue using the Microcirculations interferometer, and then you can look at distance in the biological tissue. So the key difference is really look at the biological tissue, okay? And in this case, the OCT is really a reinvention of the ancient technology that was invented by the microscope. And so how OCT works, when you use the microscope interferometer to look at the human tissue, how it works is really identical to ultrasound imaging. So we know that in ultrasound imaging, you put the acoustic waves into the human tissue, and then you use the detector to detect the acoustic echoes from the tissue. And we know that the echoes of the acoustic is really linearly related to the distance in the tissue. And so that in this case, the ultrasound can look into the tissue to look at the imaging, okay? And the OCT is exactly the same. And in this case, we're shining the light into the human tissue and measure the light echoes, okay? So somebody may ask, what's the difference between the ultrasound imaging and an OCT, okay? As I mentioned, OCT and ultrasound is identical in terms of physics. And however, the difference is that the detection side. And why is it the detection side? Because in this case, we are using the OCT to look at the human tissue. And in the OCT, we have to use the light. And we know that the light oscillates too fast, right? The oscillation frequency of the light is about 10 to power 14 hertz. And even nowadays, you do not have any detector that has that fast oscillation or faster response time to measure the light oscillations. So therefore, to measure the light echoes from the tissue, you have to use different approach. So in this case, the microscope interferometer kicks in because we know that the microscope interferometer is really like a signal mixing in signal processing discipline, okay? So signal mixing is that you mix two fast oscillation signals into low frequency, right? So that you have the detector to detect that low frequency, okay? So this is a difference between the ultrasound imaging and the OCT. And so in the OCT, you use the microscope interferometer to mix the ultra-fast oscillation of the light into the low frequency so that you have the photodetector to detect the oscillation of the light, okay? And so what is the microscope interferometer? Microscope interferometer is really simple. As I mentioned, it's kind of high school physics, okay? And to construct a microscope interferometer is really simple. You only need 4 elements to do that. So the one element is light source. Of course, you need a light source. And the second element is a beam splitter that can split the light into 2 portions, okay? And third element is a mirror, a reference mirror. That the reference mirror bounces the light into this beam splitter. And the fourth element is the detector. So detector is used to detect the light oscillations bouncing back from the system, okay? And so this is the system. So now, if I give you a laser source, we know that the laser source has a long coherence length. So for example, this laser source has a 1 kilometer of the coherence length. And then I let you to construct a microscope interferometer. I think nobody will fail, right? Because in this case, you can put a reference mirror anywhere with a tolerance of 1 kilometer, okay? And then you can see the interference of the signal, or basically the signal mixing of the light in the beam splitter, okay? And then, so for example, the system is set up, and you can use the photodetector to detect the signal mixing of the light. So signal mixing is called, in the optics field, is interference, okay? And And now, so this system is set up, as I mentioned, is using the laser light, and the laser light has 1 kilometer of the coherence length. And then you can put your reference mirror in this arm anywhere with a tolerance of 1 kilometer. However, if I switch this laser source into white light, for example, or using the strip light, okay, we know that white light has a very low coherence length. Okay, and for example, this I give you a white light source with a coherence length of 1 micron, and then I let you to construct this system. I think that will be pretty challenging, right, to get the signals at the detector, because if you want to get the signal at the detector, you have to match the optical path length in the reference arm and the sample arm with a kind of tolerance of 1 micron. Okay, so for example, I have set up this system already, and I matched the optical path length in the reference, and also matched the to attune the optical path length in the sample arm with the tool within a tolerance of 1 micron. And then you will see the interference at your detector. Yeah, of course. Okay, because in this case, you can see a very efficient signal mixing at the beam splitter, right? And now, so if I move my reference mirror away about 1 micron. So for example, I move my mirror away for 1 micron. And in this case, the optical path length in the reference arm and the sample arm are all, the difference are outside the coherence length of the light source. And you will see no signal mixing at all in your detector, right? And now, so if I put this reference mirror at 1 micron away, and this position is fixed, I still want to see the signal mixing at your detector. So what you can do? So only way I think you can do is I move my sample, right? I move my sample by 1 micron away, okay? And then in this case, your optical path length in the reference and the sample are again matched to within the coherence length of the light source. And then you can see the signal mixing at your detector, right? Okay, so if this is no problem, I think that's really simple and high school physics, okay? And now because we are working with the biomedical optics, we want to image the biological tissue, okay? So now, so if I push the light into the biological tissue, we know that the light will penetrate, right? Then penetrate into the tissue. And when the light penetrates into the tissue, if it encounters an interface, so basically the refractive index change, right? Refractive index change within the sample, it will bounce back the light, right? And so we know that the biological tissue, in the biological tissue, there has a lot of interfaces. So therefore, in the different interfaces, we're bouncing back the light, which we call echoes, light echoes, right? So therefore, the light echoes from the tissue were bouncing back from the different layer of the tissue, okay? And this different echoes encoded with the timing or distance are emerged at the tissue surface, okay? And then all these echoes were pushing back into the reference, into the beam splitter and mixed with your reference light, okay? And now, so you just sweep your reference mirror, right? At any time point, So at any time point, you have optical path length, right? And if this optical path length is matched with a certain echo from the sample, it will see the efficient mixing in the detector, right? And because we have a lot of echoes from the sample, so therefore you sweep your reference mirror, you will see constantly this efficient mixing at your detector. And in this case, at different time points in your detector, it will one-to-one corresponding to different depths in the sample, right? And I think that's no problem, right? Because we have different echoes from different distance. If you change the position of the mirror, it will have the efficient mixing at different depths in the sample, right? And so therefore, if you sweep once off your mirror, you will get one trace in terms of timing at your detector of the mixing signal. And this trace we called a depth resolved, right, signal. And in that case, you sweep this mirror here, you will get you will see depth information into your sample, right? And I think that's understandable. And any questions for this? Or I think everybody understand, right? Okay, so I think if everybody understand, and then you are the expert of the OCT. Okay, so OCT is as simple as like that. Okay, so basically this is optical as OCT, how OCT works. Yeah, and so actually OCT comes back again. You guys know this photograph, right? And so this photograph is really a microscopic interferometer that measures gravitational waves from the universe. Okay, and in this case, they are using this giant microscopic interferometer, okay, or giant OCT system. And in this giant OCT system, what the information they are using to measure the very small vibration from the universe. The information they are using is using the phase information from the microscopic interferometer. Okay, and so this is, as you know, this one is the newest Nobel Prize winner that is based on microscopic interferometer. Okay. And so this is a kind of summary slides for the features I summarized for OCT system. I summarized the 5 most important points for the OCT system. As I mentioned, so OCT, for the OCT to work, you only need 4 optical elements. So one is the light source, another one is beam splitter, and the third one is detector, and the fourth one is the reference mirror. And if you sweep the reference mirror one time, you get depth information into the sample. Okay, and so this efficient mixing is only observed when the optical path length between the reference arm and the sample arm are matched to within the coherence length of the light source you are using. And this is the most important feature for the OCT. So actually, this is the point for the OCT to work. Okay, so this is, of course, that's the most important feature for the OCT. And because OCT is the imaging technique, for any imaging technique, you have to consider how the imaging looks like, right? So one of the most important feature to judge the imaging is the contrast. So basically how clear of the image looks like. And the contrast of the OCT system is really proportional to how much light is bounced back from the tissue. So basically how much light is echoed back from the tissue. The more light is bouncing back from the tissue, the more clear of the image is. And in this case, if you look at the microscopic interferometer, so this is judged by the fringe amplitude or interference fringe amplitude. Yeah, so this is the second most important feature for the OCT system. And the number 3 and the number 4 features for the OCT system, actually that's very important because we are looking at the imaging technique. For all the imaging techniques, you have to look at how small of an object can resolve. Yeah, so this is a resolution, right? So in the OCT system, there has 2 different kind of resolutions. So one resolution is the depth resolution, okay, or actual resolution. So that basically that's into the tissue, okay. So this resolution is governed by the light source you are using. And this is the equation for this. From this equation, and this is the actual resolution, and the lambda here is the central wavelength of the light source. And the delta lambda is the bandwidth of the light source. Okay, so from this equation, we can see that the actual resolution is inversely proportional to the bandwidth of the light source. So basically, the broader the bandwidth, the higher the actual resolution of the OCT system is. And in other words, the more colors in your light source, the higher the resolution of the system you will have. Okay, so that's the actual resolution for the OCT system. And the second resolution is the lateral resolution, because we are looking at the imaging technique. Imaging is looking at the 3D space, right? So you have the depth resolution, and you also need to consider other 2 directions of the resolution. So other 2 directions we call the XY direction resolution, which is called lateral resolution. And the lateral resolution is governed or determined by the objective lens you put here to focus light into the tissue. Yeah, so basically lateral resolution is determined by how small of the beam spot you can control into the tissue sample. And the typical resolution is between 1 to 10 microns. And the typical axial resolution is between 2 to 15 microns. Okay, and one important point you guys need to know is that in this 2 resolution in the OCT system is that the actual resolution and the lateral resolution is decoupled. It is unlike the confocal microscopy or multiphoton microscopy or even optical microscopy. In multiphoton microscopy, this axial resolution and the lateral resolution, they are coupled. So in other words, in the OCT system, because these 2 resolutions are decoupled, you can separately control them. Okay, you can control the actual resolution or you can control the lateral resolution. And this is pretty unique for the OCT system. And the number 5 most important point for the OCT system is how deep the system can see in the biological tissue. Okay, and actually this is the disadvantage for the OCT system, because we are looking at the biological tissue. We know that the biological tissue is opaque. It will stop the light to penetrate, and that opaqueness of the biological tissue limits how far of the system can see into the biological tissue. And the typical range of the depth of the OCT system is between 1 to 3 millimeters. Okay, and if, for example, if you want to use the OCT system to look at the skin tissue, because the skin has a lot of pigments, and pigments absorbs the light and also strongly scatter the light, so that will stop the light to penetrate. In the skin tissue, maximum depth is about 1.5 millimeters. Okay, beyond this depth, OCT system cannot do that. Okay, so this is a kind of limitation for the OCT system, and I consider this very important because we have to know the limitations of our system, so that we can do a proper use of the system for different applications. And OCT and eye is perfect match, yeah, because the OCT uses the light to look at the tissue, biological tissue, and so therefore light likes the transparent object, right? Transparent object will make the light to penetrate. Okay, and we know that our eyeball is transparent, so therefore it's a perfect match. In fact, the OCT has the most important applications in the ophthalmology to look at the ocular imaging. And so in this case, our eye is transparent. You can push the light to the back of the eye to reach the retina, and then you can image the retina. Okay, so we know that the retina has very thin layers. Each layer has 10 microns or between 10 microns to 100 microns. Okay, so this kind of thickness is perfect for the OCT system because our resolution of the OCT system is about 10 microns. And so for other imaging techniques, for example, MR imaging or ultrasound to look at the eye, no way, because the ultrasound imaging or MR imaging, their resolution is too low to look at the retina. Okay, so therefore, it is a reason for the OCT to have a huge impact for the ocular imaging. Okay, and the movement of the OCT development over the last 30 years is really fast. And this is the example of the OCT imaging scans from my eye, actually, to basically to push the light into back of my eye to image the retina. And in this example, the system runs at 500 kilohertz and using spectrometric system. Okay, and with the 500 kilohertz system, you can run the system speed at 600 frames per second. And the 600 frames per second is about 20 times faster than ultrasound imaging. Typical ultrasound imaging is about 30 frames per second. And in this speed, you can do a 3D scans over the back of the eye. And this is kind of example. This is the top one is cross-section image, and the bottom one is a reconstruction of the 3D dataset. And in this case, you look the en-face views. So basically, to look at the XY views into the depths. Okay, and at this speed, which is very important because if you want to look at the eye imaging, our eye moves like crazy. Yeah, and that movement in the eye will introduce lots of motion artifacts. And to reduce the motion artifacts, to look at the human eye, and one way is to increase your imaging speed. Okay, and so this is really looks very nice, and you can get this 3D scans with about 1 second. Okay, and of course that's very nice. However, there has a problem. The problem is that within this 1 second, with the system runs at 500 kilohertz, you will build up more than 1 gigabyte of data. Okay, so because we want to translate the OCT system to look at the patient. Okay, and when you look at the patient, the clinicians do not have time at all to look at this 1 gigabyte of data, right? Okay, so one of the most important research activity in this field is to reduce this 1 gigabyte of data into a couple of kilohertz of the data, so that you can present to the clinicians to do the diagnosis. Okay, so in this case, so the image processing and the data size reduction to give a simple values is a very important research area in the OCT system. And even machine learning and deep learning right now kick in the OCT system to give a fast, simple values to the clinicians. And this really includes this segmentations. For example, you can look at the segmentations in this case of this nerve fiber layer, and you can measure the thickness of the nerve fiber layer. So somebody may ask why you want to measure the thickness of nerve fiber layer. And this is because the thickness of the nerve fiber layer has direct correlation with the glaucoma. Okay, we know that glaucoma is a huge problem in the society. Okay, so in this case, using this image processing, signal processing, segmentation, or deep learning and machine learning to tease out the physiological features in the OCT image or volumetric OCT image is one of the important research activities in the current research. Okay, and with that fast imaging speed in the OCT system, so you can do a wide field of view scans, which is very important. For example, if in the ocular imaging, and if you want to look at the diabetes often will first happen in the peripheral region, okay, rather than in the central foveal region. In the central foveal region is very limited. Okay, so therefore, to look at the peripheral region is very important. So in this case, the fast OCT imaging can afford you to look at wide field of view imaging. Yeah, so that you can look at the diabetes or even uveitis, right? Uveitis. Okay, and this is the normal subject scans. In the normal subject, you can have different layer information very clearly in your OCT images, because our OCT imaging has very high resolution. So in this case, about 10 microns, so that you can see different very thin physiological layers. And this is the example of the tumor in the back of the eye. Okay. And so that's the back of the eye. And actually back of the eye, we call the posterior segment of the ocular imaging. And this part has the most impactful applications for the OCT systems. And how about the anterior segment? And with that imaging speed, you can also do this anterior segment imaging. And because of that speed, you can build a 3D scans. And this is the 3D scans, a 3D scan using 500 kilohertz of the system to look at the whole anterior segment imaging. Okay, and this is the 3D rendering, and this is the cross section. Okay, so you can look at the whole eye from this end to that end. Okay, and you can also to look at the lens. Of course, that's very important, because when people are aging and their lens will getting stiffer, right? And so therefore, so you can use the OCT system to look at the stiffness of the lens, and also you can look at the stiffness of the iris. Okay, and so this is an this is an example of looking at how active of your iris is when a flashing light in front of you is flashing. Okay, so in this case, you can look at the dynamics of the iris, and of course, you can look at the lens dynamics as well. And this is really important for looking at the glaucoma, and also more importantly, I think in China, in our China, it's really the huge problem is myopia, right? So in this case, you can look at myopia as well. And there's a very small part which is at this corner over here, and the corner over here is there's a machine or organ called trabecular meshwork. Okay, this trabecular meshwork's function really functions to pump the liquid in the liquid humor over here into the venous system. Okay, so now you can imagine that the liquid will continuously pour into this chamber, right? And to get the pressure in balance, you have to pump the liquid out from the chamber into the venous system. And this pump function is achieved by a small machine over here called trabecular meshwork. So now, you can imagine that if this machine is malfunctioned, okay, it cannot pump the liquid out from the chamber, and then your pressure will be built up in the chamber. If the pressure build up, it will damage the nerves at the back of the eye, and you will lose the vision. Okay, so that's the clear. That's the has a huge implications in the glaucoma research. Yeah, and with that very fast OCT imaging systems, and you can look at this function of the trabecular meshwork over here. And in this case, and if you use the phase information of the OCT system, so you can look at the movement of this trabecular meshwork. So the trabecular meshwork is over here. Okay, so this is when in the systolic phase, the trabecular meshwork will move upward, and in the systolic phase, the meshwork will go downwards. Okay, because this system is fast, you can do real time. Okay, and this is the real time movie of how this trabecular meshwork system is working. Okay, and this is very important to look at the glaucoma. We know that glaucoma is a century-year-old problem, and even now we do not have a clue about how glaucoma develops. Okay, so if you can find a way to look at the mechanisms of how glaucoma develops, so you will become a billionaire. Yeah, very easily. Okay, so this is kind of anatomical imaging using the OCT systems, and because in the imaging we are looking at the living tissue, right? Look at the humans living tissue. All the living tissue needs the nutrition. Where is the nutrition coming from? Nutrition is actually coming from the blood. So one obvious question is that whether OCT can be used to look at the blood flow, right? And so gold standard to look at the blood flow or blood flow network in the human body is this kind of invasive approach. So in the invasive approach, you have to cut a piece of tissue out from the tissue and then perfuse the tissue with the plastic through the lumens of the blood vessels, and then you dissolve the surrounding tissues and only leave this plastic construct. Okay, and then you can use the electron microscopy to scan this construct. Okay, and then you can get this very nice pictures of vessel network in the human body. And this is the normal tissue and this cancerous tissue. Okay, and however, this is the invasive approach. You have to cut the tissue out. I think not everybody wants to do that, right? So now, the question is that can OCT be used to get the vessel network like this quality? If OCT can do this, that will be marvelous because OCT is non-invasive technique. You can do the imaging without contact to the human tissue. Okay. And so the answer is actually yes. So OCT actually can be used to get this kind of quality of the OCT images. Okay. So to look at the OCT, using the OCT to look at the blood flow or blood flow network is actually a very old story, because right after the invention of the OCT, about 4 years after, right? And Joseph Isaac and Zhongping Chen already proposed that you can combine the Doppler OCT system with, combine the OCT system with Doppler principle. Okay, so we know that Doppler principle can be used to measure the speed of the particles, right? So now, so if you combine that, you can measure the blood flow. Okay, however, the problem is that the Doppler shift, to get the Doppler shift from the moving particle, so you have to have this angle. Okay, so this angle is called Doppler angle. And if this Doppler angle is about 90 degrees, you have no Doppler shift, which means that if the if the blood flow is perpendicular to the OCT beams, you do not have the ability to measure the blood flow. Okay, so this is actually the most important reason for this Doppler OCT, even though that's almost 25 years. Okay, so this is the reason that makes the Doppler OCT very difficult to be translated into the clinical applications. Okay, so that's the first reason for, even though that's a very old technique or a very old popular technique, but it is not clinical translated. Okay, and that's the first reason, because if you want to use the OCT to look at the blood flow in the human body, and the OCT is a refraction mode, right? The OCT comes down to the tissue, and most of the blood vessels is oriented about parallel to the surface, which means that this Doppler angle is about 90 degrees. Okay, and that makes the OCT to measure the blood flow very difficult. And another aspect is that the blood flow in the capillaries is very slow. The very slow blood flow in the capillaries will make a very small Doppler shift. And that small Doppler shift is almost within noise floor. Okay, so therefore using Doppler OCT is difficult to measure the capillary blood flows. Yeah, so nowadays, most of the research or even clinical translations, they want to look at the capillary blood flows. So rather than big blood flows in the big vessels, okay, in the big vessels, you have the ultrasound to look at this, right? You do not need the OCT to look at this, okay? And there's also have another problem. And this problem is that the patient, if you want to use the OCT to look at the patient is in constant motion. So that motion will make your measurement of the Doppler shift over here very difficult. Okay, so therefore, if you want to use the OCT to look at blood vessel networks, and you have to use a different approach other than the Doppler principle. Okay, so this is about 10 years ago, and in my lab, we are very interested in using the laser Doppler or laser speckle to look at the blood flows. And we know that in the laser speckle, if you have the blood flow, or moving blood cells in the blood vessels, that moving blood cells will induce a time-varying speckle pattern, right? Okay, and if you use the laser speckle to look at static tissue or static object, okay, your speckle will be static. And that's equally applicable to the OCT system. Okay, so in this case, I give an example. And this example, I use the OCT system to scan an A line or depth scan in the biological tissue over here. And I stare at that point and then continuously do the repeated scans at that point. Okay, so in other words, I build up a time series of the A scans. Okay, so if, for example, in this A scans, I have 5 pixels, and the pixel 1, pixel 2, and pixel 5 is landed at the static tissue. Okay, and the pixel 3 and the pixel 4 is within the moving blood flow. Okay, and now, so if I repeatedly capture this A scans over time, I have time series of the OCT signals. Okay, because pixel 1, pixel 2, and pixel 5 is static. Okay, so in this case, your OCT signal will be static. So only you have some noise on top of it. And this is system noise or tissue noise. Okay, and if you want to, if you look at the pixel 3 and the pixel 4, because you have the moving blood cells in the blood vessel, and the blood cells is efficient scatter that will scatter the light. And of course, that moving blood cells will make your OCT signal fluctuate rapid, right? So now, so if I give you this time series of the OCT scans at one position and let you to identify where is the blood flow, I think nobody will fail, and very obvious, right? And you just look at the fluctuation of the signals. If this fluctuation is really rapid, which means that at this position you have a blood vessel or moving blood cells, right? And if you have no signal fluctuation, there's no blood vessel. Okay, to contrast that into the imaging approach, and in this case, you can only do 2 repeated scans. So one scan at the time 0 and another scan at time t, right? So for example, over here, I got 2 scans, okay? And if I do a subtraction of these 2 scans, or basically you do a differentiation, okay? So if you do the differentiation of these 2 scans, at pixel 1 and 2 and 5, the signal is static, right? Differentiation will give you 0, no signal at all. And however, in the blood vessel, your signal after the differentiation cannot be canceled out, right? So in this case, you do a differentiation and you get this A scan, right? And that differentiation gives you the location of the blood flow. Okay, so that's the kind of principle of how OCT is used to look at blood flows. And the principle is really simple, much simpler than Doppler. Okay, and it turns out that this kind of concept is very impactful. Okay, because that already being clinically translated and commercialized and FDA approved. Okay, and yeah, so mathematically, how this can be achieved. And mathematically, you just take 2 A scans at the same position. So at time 1, you get this OCT signal. Then, by the way, OCT signal is complex information. You have the amplitude and you have phase, right? And at time 2, you have another OCT signals, and then you do a subtraction or differentiation of these 2 functions, and you get the OCT A signals or blood flow signals. Okay, and this is the concept is really for so-called OMAG, optical microangiography. And basically that's use the OCT to contrast the blood flow within the living biological tissue. And this concept is being adopted by Carl Zeiss and commercialized and FDA approved. Oh, okay. 对，刚才I just talk about the how to use the OCT to look at the vasculatures or functional blood flow in the biological tissue. And the concept to use the OCT to look at the biological blood flow in the biological tissue is really simple. You just take 2 scans and do a subtraction or differentiation. Okay, so this concept is the key concept for OCT to look at the blood flow. Yeah, and of course, because the OCT signal is the complex signal, and blood flow will make the complex function to fluctuate, right? And that the complex function to fluctuate includes the fluctuation of the amplitude and also fluctuation of the phase signals. Okay, so therefore, so you can split to use different part of this complex function to contrast the blood flow. So in fact, there has 3 different categories of the OCT to look at the blood flow. So one is just to use this whole function. So basically that's a complex function to contrast the blood flow. So this is called complex-based angiography. Okay, and you can use the amplitude fluctuation to contrast the blood flow. This is the so-called amplitude or magnitude-based angiography. And a couple of examples for in this approach includes the decoloration or speckle variance or SADA. So split spectrum amplitude decoloration angiography. Okay, called SADA. Okay, and you can use the phase information alone to do this subtraction or variance. Okay, so this approach is called phase variance. And you have different features over here. So basically, the mechanism to use the OCT to contrast blood flow is based on decolloration and Doppler. And so using the phase is really based on Doppler. Using the amplitude is really based on the decolloration. If you use the complex function, it's really using decolloration plus Doppler. Okay, and this is the example of the comparison between different approaches. So either you use the complex function or amplitude or phase. And so in this example, we can see that if you use the complex function or OMAG, really gives you much better signal quality, right? Or signal to noise ratio. If you look at the vasculature network over here, the network is more smooth than the other approaches. For example, SADA is using amplitude, and the speckle variance also use the amplitude, and the phase variance using the phase information. Correlation mapping is using the amplitude information. Okay, so this is a kind of comparison. Looks like if you use the complex function to contrast the blood flow, gives you the best quality of the images. And why the complex function is better? Okay, and so of course, because you are using the entire signal of the complex function to contrast the blood flow. So that's intuitively, it looks like the complex function gives you better results. And there's a couple of second reason why the complex function is better. And I give 2 examples here. If the blood flow is 90 degrees perpendicular to your OCT beam, so which means that your Doppler angle is 90 degrees. And in this case, if you use the OCT to look at this perpendicular blood flow, the phase does not change. So therefore, if you use the phase variance, you won't see this blood flow at all. Okay, and if your OCT beam is in parallel to the blood flow, Okay, in this case, your amplitude will not change. Only change part is the phase, right? Your Doppler angle is 0 degrees. So therefore, Doppler shift is strongest. Okay, so in this case, if you use the amplitude to contrast the blood flow, you were not able to contrast this blood flow. And however, if you use the complex signal, you won't miss, right? If the flow information is in this direction, you can also see the phase change in this term or in this term, okay? And if your flow is in parallel direction, you will also see the amplitude change over here. Okay, so in this case, using the complex function to contrast the blood flow, you won't miss this case or this case. So therefore, the complex function is much better. Okay, and so this kind of concept is already, as I mentioned, already commercialized and FDA approved. And this is the example of Coherence system. Coherence system includes the spectral domain system and also swept source OCT system. And the spectral domain and the swept source OCT system, so only difference is the wavelength you are using. Okay, in the spectral domain system, wavelength is 840 nanometers, and the swept source OCT system wavelength is at 1060 nanometers. Okay, and in the commercial system, one of the important features for the commercial system is motion tracking. As I mentioned, if you want to image the patient, and the patient is moving like crazy, right? And you have to manage the patient movement. Okay, so this patient movement management in the commercial system is achieved by motion tracking. In other words, if the patient moves and your system moves as patient moves. Okay, so relatively, if you look at the OCT system and the patient, okay, and the system look at the patient is static. Okay, and this is a very important feature for the commercial systems. And if you are interested in clinical translation, and this is a must point you have to consider in your system design. Okay, so commercial system has the motion tracking. Motion tracking minimizes the motion artifacts, okay, and also has the function or ability to provide high definition and high resolution wide field of view imaging, which I will talking this later. Okay, and the OCT is a 3D imaging technique. Okay, in talking about the structural imaging, I'm talking about structural imaging has a huge data size, and you have to reduce that 3D data size into a simpler version of the images of the results, and that can be presented to the clinicians for diagnosis. Okay, and so in the commercial OCT system, and of course that's important to reduce the data size, and that reduction of the data size in the 3D scans is called segmentation. Okay, in the clinical applications. So if, for example, we want to look at the retina have different layers, right? And the segmentation will segment the different layers from the retina. And in typical commercial system, the retina is segmented into 3 different layers. So first layer is called superficial retinal plexus. Yeah, so superficial layers. Okay, and the second layer is deep layer. So if you do the segmentation and then do the projection, that reduce the 3D data set into 2D images. And 2D images really a couple of tens of kilobytes. Okay, and that can be presented to the clinicians. And the third layer is outer retina over here. So outer retina includes the outer nuclear layer and the photoreceptors over here, and also the RPE layer over this part, this very bright signal layer over here. And this part, in the normal eye, you do not have any blood vessels. So therefore, this layer is black. Okay, and so this layer is actually very important because if in the diseased eye, and you will have new blood vessels glowing in the retinal layer, and this layer can be used to look at the new blood vessels for the diagnosis. Okay, so that's the 3 layers. So of course, if you segment the 3 layers, and then you can combine them into a color image. Okay, this is the color image, and this is the overlay of the blood flow in the retina, in the cross-section fraction. And this one is overlay of 3 different layers into the red and the green channel. Okay, and of course, so the usefulness of this image, this images to the clinical applications is really these 3 images rather than this image. This is just color image. It's almost useless, right? And however, that's one important point for the color image is that the color image can be used in the publications, right? Because that looks beautiful. Okay, so that's the difference. Okay, color image compared to the black and white. Yeah, and also you can look at a deep colored layer in the retina. So over this part, you can segment this part into 2 different layers. One is capillaries, and the second layer is deep colored layer. And you can also look at the color image overlay. Okay, and in the colored layer, and this part, color capillaries, is most important because this part provides about 75% of nutrition to the photoreceptors over here, over this part, and to enable the vision. So basically, to able you to see something, right? If you do not have if your blood flow in this layer is malfunctioned, and you will lose your vision. Yeah. So therefore, this is very important. And so this is the example of how tracking is useful. Okay, and the top image is with the tracking off. So without tracking, and then you use the OCT to look at the moving or to the live human. And the bottom image is with tracking on. Okay, so as you can see, quite obvious, right? And in the when the tracking is turned on, you have less motion artifacts. So therefore, in this case, without the motion artifacts, that will give you the ability to quantify the blood vessel networks. For example, vessel density, vessel diameter, or even blood volume in the scanned tissue volume. And currently, the OCT system still has the limited imaging speed, so particularly for the commercial systems. Okay, so right now, fattest commercial system has the imaging speed about 200 kilohertz. Okay, so that 200 kilohertz will limits your field of view. Okay, and in this case, so if you want to look at the peripheral region, it's a wider field of view, that will be difficult. To look at the wider field of view, this motion tracking will help because motion tracking can give you the ability to scan different patches or different cubes at different positions, right? So in this case, if you scan 9 different cubes in one go, and then you can put them together to stitch them together to form a wide field of scanning. Okay, and I give you an example of the wide field of view scanning, and this is my eye, and so this is the gold standard to look at the vasculatures in the back of the eye, so basically in the retina, and this gold standard is used in the fluorescein angiogram. Okay, so in short, that's FA, right? So if you use the FA to contrast the blood flow in the retina, so you have to inject the dyes into your bloodstream, and then using the camera to capture the fluorescence. Okay, And this is, of course, this is the invasive approach. It will cause harm to people. Okay, and so this is the gold standard. And however, in this gold standard FA image, you only see a big blood vessels. Okay, and the smaller blood vessels, for example, capillaries, you do not see them well. Yeah, and if you turn on the OCT system to look at this subject or this patient, and then what you will see is this one. Okay, and because OCT is 10 microns resolution, you can see very clear or very detailed capillary blood vessels in the back of the eye. Okay, and because the resolution is 10 microns, you can zoom in, right? You can enlarge them to look at in detail of how capillary blood flow is laid out in the retina. Okay, so this is the kind of beauty of the OCT, because that's a high resolution, non-invasive. You can image the patient without any contact, right? So that's the beauty. Okay, so let's look at a couple of examples very quickly on looking at the patient. Okay, this is the example of severe diabetes. Okay, and in the diabetes, so this image is gold standard, and FA image. In the FA image, you will see pretty good information about the vasculatures, right? And you see the vasculatures drop out in this region. And also you see these dots over here, that's microangiography, which are very important diagnostic biomarker for the diabetes. Okay, and however, you do not know the vessel depth. Yeah, vessel depth is very important information clinicians wants to know. Okay, so now, if you turn on the OCT system to look at this patient, so you can see the superficial OCT vasculature map, and because the resolution is 10 microns, you won't miss any capillaries. Capillary is very in detail. Okay, and this is the deep layer vasculatures, and you can look at the color map. So you basically you code the superficial as a red color, and the deep vasculatures in green color. This gives you this color map, and this later stage FA, and you see this leakage, right, of the blood vessels, and leakage in the blood vessel appears this mushy bright areas. Okay, if you overlay the OCT system or OCT vasculature map, you will see the agreement is really good. You can see the vascular dropouts corresponding to the vessel leakage, right? And you can zoom in to look at in detail how the vasculature is related to the disease. Yeah, and this is the example is the diabetes and the later stage diabetes. Okay, so in this case, this patient needs to have the surgery or intervention, right, to stop the vasculature glowing. So in this gold standard FA image, you will see the vessel glowing over this region and also this region. Okay, but you do not know the depth information, because in this case, in the clinical intervention, you really need to know where is the blood vessel is, so that you can stop that blood flow. Okay, and if you turn on the OCT image, and this is OCT image example of this new vessels glowing over here. This purple color is the vessel glowing into the vitreous. Yeah, and this is the target for the intervention of the diabetes. Okay, so in this case, if you look at this image and this new vessel glowing in this part, and also new vessel glowing in this part, and also this part, that's quite clear. And for example, if you want to use the lasers to burn the vessels, so basically in this case, in this lesion, you have to burn this part, right? So in other words, OCT will give you very precise positional information for clinicians to treat this patient. Okay, and this is zoom in image of the detailed vasculature network. of the OCT system. And so and nowadays the commercial system is moving into the swept source, and the swept source has a faster imaging speed, and faster imaging speed gives you wide field of view in a very short time. And this is the example of the swept source OCT system to capture a field of view of 12 millimeters by 12 millimeters in 5 seconds, and which is very important because 5 seconds is kind of cut line for the patient to tolerate. If the more than 5 seconds, imaging will be quite difficult because the patient do not patient. Okay, and using this 12 by 12 scans, you can scan even wider field of view if you cut different cubes, and then after the different cube is captured, you can put them together to form this wide field of view. And this is the later stage of diabetes. And in this case, before the treatment, you can have this detailed vasculature map in the patient. And when the clinicians look at this patient, they will know the supplying blood vessels to this new vasculatures is really over here, right? Over here, and also over here, right? And or maybe over here, right? And then so clinician can use this information to treat this patient. And one beauty for the OCT is that it is non-invasive. You can repeatedly scan the same patient, right? If this patient is treated, okay, after a couple of days, the patient will coming back to scan again to see how treatment goes, right? And so this is the same patient after treatment. I think that's after 1 week or 1 month after the laser treatment. The laser treatment is really to stop the new vessel growing. And in this case, if you look at using the OCT to look at this patient, looks like the treatment is doing very well because that suppress all the new blood vessel forming, okay, in this patient. Yeah, so that's the important usage for the OCT in clinics. And so this is a summary slide for how OCT is useful compared to the gold standard of the clinical practice. As I mentioned, the gold standard of the clinical practice using the fluorescein angiogram or ICG angiogram. Okay, so FA, ICGA, and these are invasive approach. And if compared with OCT, OCT has the advantage of the faster, it's safer, right? And it's much cheaper. Okay, the cheaper means that I don't know. I heard in China, FA is really cheap. I think FA is about, if you do the FA to the patient, they only cost the patient about 250 yuan. Okay, and it's really cheap. Okay, and however, in the United States, it's not that story. It's not that cheap. Okay, in States, if you want to do FA, that will cost the patient about $2,000. Yeah, and however, you use the OCT to scan the same patient, the cost is only a couple of dollars. Yeah, so therefore, using the OCT is much cheaper, and because it's non-invasive, it can be easily repeated. Okay, so imaging can be repeated. Yeah, FA you cannot do the repetition. Okay, and do the imaging, you do not require dilation to the pupil to the patient. While FA, oftentimes you have to do that. Okay, and you can use the OCT to better image the patient through cataracts. Okay, that's very important in the patient or clinical translation. And segmentation and image processing and fast viewing allows the localization of the vasculatures, right? And also better visualization of the retinal and the choroid vessels. And the choroid, I won't discuss the choroid vasculatures because of time limitations in this talk. And nothing is perfect. There's some disadvantages for the OCT image. So this disadvantage, when you look at the ocular imaging, is that the OCT does not give you information about the vasculature leakage, which is very important in the diabetes clinic. And also vasculatures in the choroid is pretty difficult because of the limitations of this RPE layer and choroid capillaries. And because this RPE layer and choroid capillaries is highly scattering, that stops the light, goes through deeper into the choroid. So of course, these two research directions are still ongoing. So in fact, the OCT is able to look at the leakage of the vessels, and also OCT is able to look at the choroid blood vessels. Okay. And so this is the OCT applications in the ocular imaging in ophthalmology to look at the eye, and OCT has other applications as well. So I will give you a couple of examples for other applications, and my first other applications is brain imaging.
对于血管内粒子运动的散斑检测，以深度3和深，你能简单的阐述一下？
Right. So for the aging society, that the problem is Alzheimer's, right? Alzheimer's is a huge problem. And of course, in neurological diseases, you have the stroke. Stroke is third leading cause of death. And very important, traumatic brain injury. So all this brain imaging, so stroke, Alzheimer's, traumatic brain injury, or aging, really a small vessel disease. Okay, for the small vessel disease, you need resolution of the system. And you can use the MR imaging, or you can even use the ultrasound imaging to look at the blood vessels. However, the resolution of the MR and ultrasound is very limited. You cannot look at the capillaries in the brain tissue. And OCT has a high resolution, of course, that's very useful to look at the small vessel diseases. And I just gave you examples of how OCT looks like if you use the OCT to look at the brain tissue. And this is an example of using OCT to look at the mouse brain. And because OCT is 3D imaging technique, so you can use the segmentation to segment blood vessels in different layers, right? And in this image, I showed here is the whole brain imaging, but this vasculature is right below the skull bone, okay? And right below the skull bone, there's a layer called the meninges layer. And that meninges layer in the animals is about 20 microns. And in that layer, you have very slow blood flow, and the vessel network is also very rich. Okay, so this is this layer, vasculatures in the meninges layer. So somebody may ask why you show this layer. Why is that important, right? I believe everybody got a headache, right? And I have a headache almost every week. Okay, so headache is actually happening in this layer because only in meninges layer you have the pain sensors. Okay, so if you feel headache, and there must be this layer got a problem, or even the vessel is dilated. Okay, dilation of the vessel, pain sensor will feel. Okay, so therefore you got the headache. And this is the kind of category of the migraines. Migraine is a huge problem in the society. So therefore, if you use the OCT, then OCT may shed some light to look at the migraines, right? And as I mentioned, the OCT is a 3D technique, and you use the segmentation to look at this vasculatures in the meninges layer, and you can peel this meninges layers off. You look at detailed information in the brain tissue, okay? And because the OCT has a resolution of 10 microns, you won't miss the capillaries at all. Okay, so this is the capillary network in the cortical tissue. So you can imagine that OCT can be pretty useful to look at small vessel diseases in neurological diseases, for example, stroke, right, and Alzheimer's. Okay, and here I give you an example of traumatic brain injury model in the animal models, and because OCT is a non-invasive, non-contact. Okay, so you can use the OCT to repeatedly image the same brain over the days. Okay, and this is the example of the OCT image in the control. Yeah, so before the injury is made to the animal. Okay, and then after this image, you make an injury over here. So, and then you, right after the injury, you do the imaging using the OCT. And you can clearly see the injury part over here. And also you see the ischemia happening. So ischemic, yeah, in this part of the brain. And then you scan the day 1 and day 7 and so on and so on, and scan 4 weeks. So one obvious feature in the OCT image is that OCT can look at the angiogenesis, right? Because the tissue is injured tissue needs to heal. So healing process will make the angiogenesis. In this case, angiogenesis is good. It's good that will assist the tissue healing, right? So obviously the angiogenesis you can see using the OCT system. So another feature you will see is that the total blood flow, right? You see this signal intensity is going down, and at the day 7, the signal is lowest, yeah, and then they're going up, come back to normal, right? And this is a very important phenomenon, yeah. So-called vasospasm, right? And probably you guys heard that when people has a car accident, right? So right after the car accident, yeah, and the guy or the lady feels no normal at all, totally normal. So after a couple of days, they experience huge, severe headache. So this is called vasospasm or delayed response of the injury. Okay, so this is the vasospasm. Okay, so it looks like OCT is pretty useful to look at all the vessel involvement in the injury. Okay, so this is kind of just a quick example using the OCT to look at the vasculatures or vasculature involvement in the brain tissue. Yeah, and the second example I want to mention is the skin imaging. Yeah, because skin is easiest organ for us to access, right? So obviously OCT has this kind of applications to look at the skin. And in the skin, you can look at the diabetes, you can look at the skin cancer, and even wound healing, right? Or burn, right? The wound healing. And also you can look at the cosmetics. So acne, rosacea, and psoriasis, and port wine stain. Yeah, and all these are very important in skin imaging. And I just gave you a couple of examples, right? Because OCT has a very high resolution. You can build skin models in animal models. Yeah, and in this case, I just gave you an example of using the OCT to look at the vasculature in this mouse ear flap. Yeah, mouse ear is very good wound model. Okay, because the vasculatures in the mouse ear is very simple. Yeah, it's not like the body tissue. Body tissue vasculature is very complicated. Okay, so in this case, because our OCT system is 10 microns resolution, if you're imaging this mouse ear tissue, you won't miss any capillaries. Okay, as you can see, the capillaries are very rich, even though the vasculatures in the mouse is pretty simple, but very rich. Okay, so in this case, using this mouse ear, you can use as a disease model. So for example, you can cut the tissue in the mouse ear and then you watch how this injury is going to heal over the time, right? So for example, if we cut this main blood vessel over here, yeah, and one intuitive thinking is that if you cut this vessel here, and because this vessel supplies all the downstreams over here, right? And if you cut this, what you will think, obviously my first thing when I do this experiment is that all downstream will become ischemic. However, actually that's not true, because all the biological tissue is really smart, okay? And if you cut this, the blood flow in the downstream does not change at all. So let's look at this. So using the OCT, and in this case, using the OCT, you take a control scan and you cut this vessel, and right after the cutting, you look at the downstream blood vessel networks, okay? And still in downstream, very much functional. And the shape of the blood vessel is almost identical over here. Only a small difference is diameter of the vessels is dilated. Yeah, of course, dilation is kind of, dilation of the vessels is kind of a response of the tissue to the injury. Yeah, you can using the OCT to scan the same wound over different days. Yeah, this red part is really angiogenesis. And after 3 weeks, the wound is healed. Okay, and the healing part, as you can see, the vessels is not completely coming back. So actually that leaves the scar over here, right? And in this experiment, the resolution of the OCT system is about 20 microns. And oftentimes clinicians want to see how capillaries in response. Yeah. So in this case, you can increase the OCT system resolution to look at in detail how capillary is going to respond in this injury model. And so this is kind of 7 weeks image, and using the a system with a resolution about 5 microns. And the average size of the capillaries is about 7 to 8 microns. So therefore, in this case, using 5 microns imaging resolution, you can see the capillaries, okay? And as you can see very in detail of how capillaries is involved in this wound healing model. Yeah, and this is really angiogenesis happening over here, and then migration, and eventually come to the scar formation over here. And the beauty for the OCT system is that it not only can give you the vasculature involvement in the wound healing, it will also give you the morphological information. So morphological information, as you can see, bottom over here, cross-section image, is that you see this epithelium layer over here. That's because wound healing involves the epithelium cell migration. Yeah, so migration really helps the wound healing. And using the OCT, you can look at this migration, and which is very important. So therefore, the OCT is really useful. And this is just the examples of using the OCT to look at the animal models. So how about the OCT to look at the humans? So this is one of the very important activity in the OCT field, is to translate the OCT to look at the clinical applications. And this is the work in my lab. We are kind of doing clinical prototype to move in a purpose or in a hope to move the system into clinical settings to look at the patient. And this is the first generation of the OCT system. We packaged this on this table, and at about 5 years ago. So this is the first generation, and the beauty of the OCT, this system, is that we are using the swab source with a very long coherence length. Okay, and in this case, this very long coherence length of the swab source gives you kind of about 10 centimeters ranging distance. Yeah, and long ranging distance is very, very important for skin imaging because our skin is not even, right? It has a quite big curvature, and that curvature requires your coherence length of the light source long, or ranging distance is long. And this system has a 10 centimeters ranging distance. And using this 10 centimeters ranging distance, you can look at the whole head scan. Okay, so this is the example using that system to scan the whole face. Okay, this one and second, because the OCT, the 3D scans, so you can look at the depth information. And for example, you can look at the glass position and also the eyelash and cornea and the eye lens and also skin side as well. So that gives you depth information. Yeah. And because of curvature, the curvature of the facial skin, that the 10 centimeters ranging distance is very important. And you can use this system to look at the vasculatures as well. And you can use in this system to look at the whole the vasculature in the palm. And the system has a resolution about 20 microns, so you can look at the capillaries in the palm. Okay. So this is the first generation of the system, and we since had a second generation of the clinical prototype. And this system works at 1310 nanometers with a scanning speed at 200 kilohertz. Okay, and the ranging distance is about 50 millimeters, 5 centimeters. Okay, and so this is the system looks like, how system looks like, and this, of course, the system can be moved into clinical settings to look at the patient. Yeah, and then let's just look at one example of using this system to look at mouse ulcer. Yeah, this is because that's the handheld. You can look at the mouse ulcer, and this is mouse ulcer over here. And of course, from the pictures, you can see the redness of the surrounding tissue, right? This redness is really the vasculature remodeling. And using the OCT, you can look at how this vasculature is remodeled in this mouse ulcer, right? And this is 10 by 10 scans, and this is 5 by 5 scans. Yeah, 5 by 5 scans has higher resolution because we want to look at how vasculature is involved in this mouse ulcer, right? And you can see that OCT gives you very much detailed vasculature information in this disease model. And because that's the 3D, you can look at segmentation to look at the different layers, right? And you can look at papillary layer. Papillary layer is over this layer over here. And by the way, this is structure OCT image, and the structure OCT image will help you to do the segmentation, right, at different layers. And this is the papillary layer. In the papillary layer, the vessels, just like a pin vessels, okay, and which is about perpendicular to the surface. Yeah, and this is the collagen layer or laminar propria layer, and this is the muscle layer. Okay, so and you can look at color coding to look at how detailed how the vessels is involved in this disease, right? In much detail. Okay, and this, with that, this is my take-home message. I think my time is up. And I showed you that OCT is really capable to provide microstructure information and microcirculation information with a resolution about 10 microns, okay, in 3D, which is very useful to look at the capillaries. And the important part for the OCT to contrast the blood flow is that it uses intrinsic scattering signals from the tissue. So therefore, it is totally non-invasive, labor-free imaging technique, okay? And currently, the minimum resolvable blood flow is about 4 microns per second. It's really slow. And I give you a kind of example of how this looks like, this speed looks like. We know the Brownian motion, right? So Brownian motion of the particle in average is about 50 microns per second. Okay, so therefore you can use the OCT to look at the capillary blood flows, no problem. Yeah, so there has lots of applications. Of course, the most important application is in ophthalmology, and also you can have the OCT to look at the neurological diseases and Alzheimer's and aging. Okay, and the most important for the OCT is really it is non-invasive, it's real-time, very cost-effective compared to the MR imaging and X-rays and ultrasound. And nothing is perfect. OCT has a huge limitation. And OCT, this limitation is that OCT is a shallow imaging technique. So maximum depth into the tissue is about 2 millimeters. If you want to look at the skin tissue, the maximum depth is about 1.5 millimeters. Okay, so this is a huge limitation for the OCT. And again, I want to thank my local collaborators, external collaborators over here, and also my team members who give the results to me for this presentation. So any questions and discussions?
谢谢王老师。
OK，
对，刚才王老师其实用了将近2个小时的时间呢，给我们就是做了一个非常详细的一个，首先是在这个 OCT 的一个原理，从脉冲型干涉仪出发，然后到介绍它的这个基本的一些技术，包括时域的、频域的、扫频的，包括这个副场 complex field 的这些 OCT 的一些基本的技术，并且呢，也给我们展示了在目前医疗临床仪器方面的转化。介绍在眼科、在脑成像以及皮肤组织成像方面的一些应用，也特别是这个让我们耳目一新是对这个诊断的一个帮助，不仅仅是做 publication， 而对我们的医生的诊断，提供了一个非常有效的工具和手段，应该说给我们开了一个眼界。那么下面呢，我们就是根据在我们聊天区以及2个在线直播平台反映过的问题呢，和王老师做一个后面的深入的互动和交流，好吧？那么就是我看到在我们这个聊天区呢，已经有不少老师和这个平台把问题放在这里了。那么首先呢，我们看到这个复旦的沈超老师，沈老师反正是跟我们是朋友，好朋友啊，他是做这个短波长，这个 SLD 和这个就是400纳米到蓝绿光波段的这样一个光源。半导体光源的一个工作，包括用在这个空间通信和这个水下通信。那么他就问这个问题，就是说呢，能不能够用这样的一种光源，用在 OCT 里面，提高它的这个分辨率呢
？I think 这是很好的一个问题。那个用短波长做 OCT 来 implement OCT 还是有很大的用处的。有现在比如说的话，用短波长的可见光。来做 OCT 的话，因为可见光对那个oxygenation 很敏感，这样的话用可见光来做 OCT 就可以看那个 oxygenation， 但是它有个缺陷就是 penetration 比较低。一般的越短波长的话，那个 scattering 就越高嘛，对吧？
对。
这样的话呢，那个imaging depth 就变得比较 shallow。但是我觉得，如果要用这个更短波长的，这个 blue light 到可见 ，right？我觉得它的应用还是有很大的应用的。但是这些应用呢，有可能在 industrial application。OK。但是在人体 application 可能比较 difficult， 因为的话，也超短波长的话，因为它那个能量比较足，对吧 ？energetic。这样的话也可能就是 safety 有一些 problem。Even right now, the visible OCT using the visible light to image the humans has a problem of the safety.
OK， 明白。对，好的，谢谢王老师啊。那么那么下面就是有一个一个比较偏向于技术方面的问题，就是是来自于这个扣响学术平台的。 那么在线的观众提的这个问题是您当时提到在这个 blood vessel 通过这个 speckle detection 看这个 particle motion， 当时我记得你扫了5个点是吧？
对。
那么在 DES 3和4，就是举例子哈，如果说你用它来看这个 blood vessel 的这个运动的话呢，就是你怎么能够确保这个 speckle signal 它不会被这个上层的这个 shadow 所影响呢？
Yeah. 对，这个是很好的 question。假如说，那个要 static 在 vessel 上面是 static tissue， 那应该没有问题，对不对
？OK。
如果这个问题是 coming， 就是说你有2根 vessel， 这一个 vessel 在上面，一个 vessel 在下面，对吧？这样的话，这光子啊，这经过这上面这个 vessel， 然后再 penetrate， 这个经过上面这个 vessel 它已经 Doppler shifted， 对吧？然后再到下面。再往下面的话，会 cast 一个 tail， 这个 tail 叫 projection artifacts。这是一个很大的问题。但是说，在眼科应用和skin 应用里头，它现在有一个算法，就是怎么去 eliminate 这个 shadow， 这个 tail artifacts。OK，
明白了，就是可以通过算法来处理，是吧？
对，通过算法来处理。
OK。好，那么可能还是同样的一个问题，就是同样一个方面的问题，就是说，在这个 blood vessel 这个场景下，就是能不能够再详细的说一说怎么样应对这种，就是 continuity 和这个 orientation of blood vessel。
对 continuity 这个其实是一个很好的一个 question 啊，因为我们的 blood flow 在这个 blood vessel 里头流的时候啊，它是个 pulsatile。对不对？它有时候这个 blood flow 它会 static， 就等于是这个 stagnation， 就等于不走不流。它会有的时候在 capillary 里，有的时候不流，然后过一段时间再走，哎，再不走，再流。它这个其实一个很好的 question， 但是说，yeah， 但是如果你这个 OCT system is properly set up and properly designed。So actually, you can look at this 就是 pulsatile behavior. Yeah.
OK。
就等于是 Yeah。
可能还是同样一个老师提的问题，就是说how to eliminate the transverse line effect after tracking mode on。就可能这个就是说，就当时您说的这个，当时说的那个 size 它有一个仪器嘛，是吧？可以打开这个 tracking mode。tracking mode 是避免这个重影和这个效果。他说能不能给一些 more detail explanation？
more detail， 这个其实比较 complicated。这个是比较 complicated。这个 lateral motion 的话是它的目的就是 tracking 就用 lateral motion 来 track， 对不对？它 tracking 呢是用 SLO 来 track， 就等于是有个 confocal system。在 confocal system 它有一个就 XY 这个 map， 在 XY map 上它有那个vasculature information， 对吧？它用那个 vessel 作为 landmark 来 track， 就是 XY tracking 还是可以，但是那个 depth tracking 还是没有。但是 depth tracking 的话，你也可以用算法来做的，对吧？
好的，明白了。好，那么这个还有一个问题就是可能是偏向于临床和这个治疗方面的。这个刘老师他说呢，请问王老师，这个 OCT 可以提供血管不同状态吗？比如说出血管消失、血栓、血流停滞。他的意思就是说呢，在用光动力疗法治疗血管性疾病的时候，有时候治疗过度，有时候治疗不足。那么术后随访发现这个病变血管也没有消除。他的意思就是说，能不能够如果 OCT 可以在激光治疗过程里面判断血管的不同状态，通过术后的随访来确定治疗终点，对临床会很有帮助。请您评论。
Yeah. This is a very good question. And 我觉得要这样做，OCT 还是可以，就是说，当然，如果他这个血液在就是 blood clot 在这里头不走的话 ，OCT 还是有一些问题。因为它那个把它认为是 static tissue， right？OCT 来 contrast the blood flow 必须 moving blood， 但是如果要看光动力疗法的那个效果的话，我觉得看的 blood flow velocity 是比较好的。你可以 judge 就是血流快和慢啊，我觉得还是一个 assessment， 一个 parameter， 对不对？
对 ，OK，
OCT 来测量 blood flow velocity 是可以的。
OK， 好的，明白。那么，还有一个问题就是说呢，请问这可能针对您刚才提到这个皮肤方面的这个应用，就是它可以定量测量这个毛细血管网络的每一个血管的流速和血流方向吗？
这是可以的。现在我们这是一个比较 active 的 research area。我们在这有很多个 project 都在做这个，我们叫做 capillary velocimetry。OK，这个 capillary velocimetry 的话，工作的原理基本上跟那个 laser Doppler laser speckle 差不多。你看，它就看这个 fluctuation，in the fluctuation of the speckle is related to the velocity， 对吧？这基本上基于这个原理，但是真正的工作起来可能还是比较 complicated。在那思路就是这样，但是可以来测这个 capillary flow 的 velocity。
明白。好的，下面就是可能就是差不多是应该是最后两个问题了，就是有位观众提到就是说呢，虽然说我们的 OCT 这个市场可以比较大，甚至到厘米量级，甚至几个厘米，但是呢，这个 penetration 还是限制在1-2个毫米，就是主要因为 scattering tissue 的问题。但是 what do you think is the essential factor 就是 prevent us seeing deeper layer？就是主要是因为什么原因限制我们的？
对，主要的原因就是 scattering， 这因为我们的 tissue 是 opaque， 对吧？因为tissue scattering too strong， 但这个 scattering stops the light penetrate。
是不是因为这个 scattering light 导致这个 backscatter light 太 weak 还是怎么
样？Yes， 因为你这个 light 我要必须要不需要往下走，对吧？因为往下走的过程，它那个 scattering 就很高，然后到某一个 layer 再回来，这个回来的光已经很弱了，这很弱的光还得经过这个 scattering，对吧？这个是主要是这个 scattering 是一个问题，但是有一个比较 interesting approach to improve 这个 penetration is optical clearing。这个我们朱丹教授就是我们这个我们这个专家，他用这个 optical clearing 把这个tissue 变得 transparent， 对不对？变得 transparent 以后，你可以进的更深的一个地方。
对，明白。OK， 明白了。最后就是可能就最后一个问题了，就是说这个可能提到这个跟其他医疗手段的比较，就是OCT 在这个血管内壁断层扫描的探测深度和精度以及检测速度如何？它能不能达到传统的血管内壁超声断层扫描仪 IVUS 的探测深度吗？
这个跟超声比的话，速度是肯定比超声要快。IUVS 要比超声要快，但是因为那个血管壁的话，那个 scattering 比较高的，所以它那个就是深度成像深度要比超声要浅得多。但是它 resolution 要比超声要高得多，对吧
？OK， 好的，明白了。好，最后突然又来一个问题啊，王老师，这个就是真的最后一个问题了啊。
OK， 没事。
OK， 就做那个它还是您这个就是那个 blood vessel 提取这个血流速度，他说做那个相位相减算法之前需要做预处理吗？因为不同层强度不一样。
对，这需要做预处理的。
OK，
就是用那个辅值来做的话，也要做预处理的。它整个必须这个data 进来以后，你因为有 motion artifacts，right？你需要 reduce the motion artifacts，even 就是说你已经有 motion tracking 了 ，motion tracking 仅仅是能够 track 大的 motion， 对吧？还有小的 motion， 小的 motion 没有 track 住。 所以说预处理还是要的。
OK， 明白。好，就是最后我王老师问一个我个人感兴趣的问题啊。
好，
就是
好，
因为现在我看了很多用这个scattering 用这个应该是用这个 deep learning 来辅助做这个 scatter media 的这个成像。
对，
包括在这个用这个类似于光线里面用多模光纤的 speckle 做这个imaging reconstruction。
对，
有没有可能就是用这种reconstruction 的方法用在这个 OCT 的这个 lateral 的这个 XY 这个上面？
这个还是有可能的，因为这个 OCT， 而且这 OCT 就是光 propagation 嘛，对吧？within the tissue， 现在有一个approach 叫 synthetic image， 在 OCT 里头，它这个 synthetic image 也就是跟那个 reconstruction 类似的想法。它就是 trace 怎么就是说ray tracing 啊，其实也就是 ray tracing 在 tissue 里头，然后再 reconstruct， 这样的话你可以minimize the deformation， 因为你那个 tissue 有 aberration 啊什么，肯定有好多那个 dispersion 啊在 tissue 里头，对吧？在这一般的成像里头，我们还没有基本上不考虑这个 aberration 啊和 dispersion。在 tissue 里头，我讲的是 tissue 里头啊。所以说，它这个如果要把这个 concept 这个 reconstruction 啊，那个 synthetic approach， 我觉得会提高它的精度和用处。但是这个 reconstruction always involve the speed, right? Requires a time to do this. And the timing is a huge factor that stops the clinical translation.
OK.
Yeah， 要临床应用的话，它要快 ，right？
明白。
所以是它有个 balance。
OK，understand。OK， 谢谢。好的，那就我看现在我们的问题基本上都讨论完了。那么非常感谢王老师这个非常耐心细致的解答，给我们这么多的这个精彩的这个输出。后面我看就是周老师，你要不要再说两句？
好，王老师，您提的这个报告呢就是我们是除了这个腾讯会议，然后后面还有2个直播的平台。我大致的看了，可能不是一个最准确的数据，但是今天的这个在2个平台和会议的总共人数是超过3000人的。所以这个应该来说，只要是给国内做报告，我们的这个就是研究人员还有我们的一些学生的关注度都是非常高的，比平常的小会议来说，所以用这种公开课的形式，可能是一个非常好的方式，因为后面还有回放，我们可能像这种国际上面最杰出的科学家给我们做的报告，将来我们会把它作为这种经典的这种案例，可以，因为它可以回放嘛，以后上课的时候都可以来参考。
没错。
而且
它这个跟那个一般的会还不一样，因为会的话，它人数还是 limited， 对吧？
对，更重要的就是因为这个课讲的这个相当于，比如说差不多将近2个小时嘛，就相当于从一些基本的原理开始到系统到应用，所以讲的比较完整清晰，就适合这种刚刚涉足这个领域的，或者说未来希望涉足这个领域的人都可以，就说可以，他的这种就是受益面非常的广。那个实际上我这里想因为 OCT 它实际上是可以实现这种长期成像的，也就是说它实际上就说是可以做这种三维的。当然我们看到的结果深度的这种信息也非常的明显。我不知道是不是王老师今天是不是因为担心网络传输的问题，好像没有怎么展示这种三维的这种图片。
没有这三维图片倒是挺多，也有 movie，因为主要是这个我怕这个 internet 这个 movie
对，怕网络不顺畅是吧？
对，没错。
对，因为 OCT 成像这个是 它是实际上就是说，它是有这种三维的这种长期能力的，
没错，
所以就是
没错，
而且因为它的扫描吧，相当于 XYZ， 反正根据你所需要的区间，你可以扫多大范围，实际上都可以的。
对，
这个可能就是和其他的这种系统上是不一样的。这个技术现在在临床上面已经应用的比较多了。
是的，比如它 OCT 还是比较 flexible， 对吧？
对，
它最主要它那个，我觉得它跟那个核磁共振啊、X 光啊、超声啊，它的门槛要比他们低得多。
对，
这个还是比较重要的原因，对吧？因为我刚才我刚才说了嘛，这就是一个高中物理的东西嘛。
那不是原理，最基本的原理是基于麦克斯韦，这个就是基于这个麦克尔逊干涉仪，但是真正要把它做好，这个还是不容易的。虽然现在就是国内就很多，包括像您的学生，我今天看到了那个上面安宁现在不是回国了以后也是在国内做 OCT， 也还有那个浙大的李鹏啊。都是从您那里回来的，现在也做得非常好。
也是的，是。
好的。那么我们
好，
今天就我们可以到这里了，好吧？谢谢王老师。
好嘞，
再次感谢王老师。
对，如果你们还有什么问题的话，可以直接跟我 email 就行，没关系。
好的，谢谢王老师。